Good afternoon. Welcome back to Move Better with the Cheer PT. Today, we're going to talk about what are the common injuries that you might see in cheerleading and what to expect as your cheerleader enters the cheer world. This is a review. It's a little bit different topic today, or a little bit different presentation. It's a review of some literature that just came out recently in 2022. And the article is Understanding the Cheerleader as an Orthopedic Patient. And they do a review of the literature to go over what the top injuries are and what to expect as an orthopedic. It's really geared towards physicians and other healthcare practitioners, because we're just starting to acknowledge cheerleading as a sport and seeing cheerleading as orthopedic injuries, even though that's been growing for years. I liked this article. So it was published in the Journal of the Orthopedic Journal of Sports Medicine, believe in January of 2022. It was written by Amy Xu. I apologize if I've mispronounced your name, and you can find it in the link below. I'll leave a copy a little later on in the link below. If you want to read it more in depth. But they talk about 10 topics that are important for treating a cheerleader as an orthopedic patient. The article actually supports the research that I did in 2016, which talked about the type of injuries and how injuries occur. And the good thing is that's not changing much. The bad thing is it's not changing much in the last 6 years. I think people are becoming more aware, and there's more people paying attention to cheerleading injuries now than there were back in 2016. In 2016, I had a hard time finding articles that were, that were less than 5 years old. And so in the last 10 years, they've really done a lot more research, and it's getting more prevalent to have articles and research articles regarding cheerleading injuries, which is awesome, because as cheerleading enters the mainstream sporting world, we're just going to keep getting more notification. The bad thing there is that also means that we're maybe more we're more aware of injuries. And so it's my goal. If you don't know me, I'm Laura Turner. I'm the Cheer PT, and it's my goal to educate and provide information on how to reduce risk of injury and recover from injury and return to sport after an injury, so that we can keep cheerleaders healthy and safe and on the mat and enjoying for life. And if you are a former cheerleader, to be able to stay healthy and safe and still do what you want to do, even if you've had a prior injury. So let's dive into these 10 topics for treating the cheerleader as an orthopedic patient. Number one, they talked about the health benefits of cheerleading in general. And it's a high endurance sport. There's a lot of high intensity training and a lot of impact activity, which is excellent for building bone growth and muscle growth as well. And so if your cheerleader is starting young, that developing that bone growth and that because of the jumping that's involved and the impact activities with tumbling and stunting as well, you really actually stimulate bone growth, and that can carry over to later in life. So you're less at risk for osteoporosis. Some health risks. They talked about a topic that's new to me, or a diagnosis that's new to me, called relative energy deficient in sport. And that is when there's that cheerleaders are, because they tend to be more of an aesthetic sport, have a higher risk for this REDS. And they may be low energy because they are not eating as well. Maybe their protein sources are less, their carbohydrates are less, because they're trying to maintain that body image. And when we don't eat well, and there's a higher risk of whether it's anorexia or just a change in our eating patterns, we may put ourselves more at risk for menstrual cycle changes. And when we stop our menstrual cycle because we are exercising too hard or not eating right, we then set ourselves up for a higher risk of osteoporosis in the long run. So this is a health risk for cheerleaders, and it's something that I think is something that we can be mindful of and remind our cheerleaders that we need to eat healthy. We need to get our good greens in and our calcium in to help the bone growth and to support what we're doing as our sport and building that bone growth as well. different patterns. Number 3, they talked about the patterns of injuries. The most common injuries that they're seeing, and this is the same as it was in 2016, are ankle injuries and ankle sprains, followed by wrist and hand, back injuries, and knee injuries. Most injuries are seen they occur at competition as opposed to practices. They happen while basing, coming down, falling out of a stunt, twisting injuries, like out of a tumbling or twisting the wrong way, and collision injuries. And that's actually those mechanisms of injuries haven't changed over the course of at least 6 years, probably longer, because my research was looking at the prior 5 to 10 years. The great news is that catastrophic injuries rates are relatively low. Catastrophic injuries are classified as head and neck injuries, but those are relatively low in cheerleading compared to other sports. But the concussion rate and head injury rate has actually been on the rise. So that's number 5, the concussion rates. And I think this is a big area of, for me, a big area of concern, because concussion to me is a bigger injury than an ankle sprain. Ankle sprains can happen because a twisting or a pivoting wrong or stepping wrong. It's pretty common. There's ways to prevent them by making sure your ankle mobility is up to par and you have good strength and that you're watching where you're stepping. They may last a little bit longer as far as creating other injuries, but you can get things stronger in that. A concussion, sometimes people don't see. And so as a parent or a coach, you may not recognize that your cheerleader is having symptoms, but these, even subconcussive rates, so it's not really a full-on diagnosed concussion, can lead to neurocognitive changes and decreased functioning overall. What does that mean? So their focus in school, their ability to do more advanced learning tasks, math and science, and their overall processing, their ability to make good judgments. It's that those can decline if we have concussions. And if they have a concussion earlier than 12 years old, there's double the risk. So I think it's super important that we pay attention to if our cheerleaders are having concussions, because a repeated concussion, which is very common, especially under the age of 18, leads to more cognitive dysfunction. And it's not something that is glaringly, like if you have an ankle brace, you have an ankle sprain, you put a brace on and you keep going. But that you can't do that with a concussion. You need to let things have time to heal, let the brain recover, challenge gradually, start to do different tasks to help that recover. And just because somebody doesn't necessarily look like they have a headache doesn't mean that they don't have blurred vision symptoms or dizziness or fatigue symptoms. And that all will feed into what they're doing, not just in cheer, but outside in life as well. So please pay attention to those, because those are super important. Number 7 was, looking at whether or not there was a difference between all-star or scholastic. And basically, the bottom line is there's no difference in the injury rate. School cheer, whether it's high school, college, or youth, has the same injury rate as an all-star. Even though all-star may be doing a higher level skill than a high school team, the injury rate is about the same. For whether it's flyers or bases that have bigger risk of injury, both have a bigger risk of injury. Flyers tend to have a little bit more catastrophic risk. Doesn't mean that they're going to have a catastrophic head or neck injury, but they have a higher risk of that. And bases have a higher risk for overall overuse injuries or repetitive strain injuries, such as low back or sprains. The not so good news, but I believe there's a reason for it, is that cheerleading is surpassing football in the concussion rate, but they are having less overall overuse injuries than other athletes, such as tennis and soccer. So not so great that we're having more concussions than football players. I do think part of that stems from we are now reporting and people are being more aware of it, and the doctors are taking more note of that they are having concussions. I think people are starting to keep track a little bit more. So I do believe that the way our skill has progressed in the last 20 years, there are more concussions happening, but I also think that there are more reported happening. So that's a good thing, because the more we are aware, the more we can make changes to help keep them safe and not happen. But it's the more we become a sport, the more people are aware of us, and the more research there's going to be. So it's going to get documented. And the last topic, the number 10 that they talked about, was, what are preventative measures? They were clear in that, it is important that the organizations, the higher ups who organize and keep track of cheerleaders, that they put rules in place to keep those safety regulations in place. The one article I read a few recently was that since the 2006 rule change on basket tosses and 2.5 high pyramids on basketball courts, the overall, injury rate has gone way down. And so that rule is in place for a reason, and that's helped. And so, the high school federations and the all-star federations and the overall governing cheer bodies that have made these rules in place to keep us safe is working. But the bigger point is these organizations can't keep us individually safe. We, as individual cheerleaders and as parents and as coaches, need to do the job of teaching our kids the risk of injury, or the risk of how we injure ourselves, and being, still staying true to reporting it. If you do have an injury, you have a concussion, if you have a headache and you don't know if you have a concussion when you come out of, if you fall and you hit your head, you don't recognize it. But, encouraging our athletes to speak up, to talk to the coaches, as a coach, being open to listening to what your cheerleader is going through, and what your athlete is experiencing, is important to helping prevent more injury down the road. Encouraging our cheerleaders to take time off to rest, to allow their body to heal and recover, helps them to do better in the long run and have less injury in the long run. So allowing that conversation to happen, being open to discussion, knowing that cheerleaders, will be injured, and there are things to do to prevent that. Encouraging good nutrition, encouraging them to eat so they don't stop eating altogether, and encouraging healthy exercise that includes some mobility and some strength, and also some time off to recover and rest, feeds well into keeping the overall health and safety and preventing or reducing risk of injury in cheerleading. This is a great article. I will definitely leave a copy of that in the show notes. And I would love to know what your biggest takeaway from these 10 things, the health benefits, the health risks, the patterns in cheerleading and where the injuries are, what the catastrophic rates are compared to other sports, how concussions affect you, if you're noticing a difference between all-star and high school and school cheer on injury rates, and whether your flyers, your bases are getting more injured, and what their injuries are. Leave a comment below or send me a message, because I love to hear about it, and I'm always interested to see what people are seeing out in the real world, not just from articles in journals. I look forward to talking with you more about preventative measures or reducing our risk measures of injuries. And I look forward to talking with you soon. And stay tuned, because I will have an ankle workshop coming up shortly. And we're going to talk about reducing ankle sprains, reducing the risk of injuries for ankles, and recovery and return to sport after an ankle. So stay tuned for that. And if you're interested, please leave me a message and I will make sure I get you that information. Don't forget, when in doubt, breathe out, take life one step at a time. And as my dear friend Drew Kelleher said, you are responsible for your own vibes. Go bring it. Have a great day. I'll see you next time.